August 6th, 2026. Right now, health officials across nearly every state in America are racing to contain an outbreak that's already blown past anything the country has seen from this specific parasite in recent memory. More than 22,000 people have gotten sick since the start of May, 517 have been hospitalized, and 2 people in Michigan have died, the first confirmed deaths tied to this parasite in a U.S. outbreak in years. The culprit is Cyclospora, a microscopic parasite responsible for what's been bluntly nicknamed the explosive diarrhea illness, and at least one major source has already been traced back to shredded iceberg lettuce served at one of the country's biggest fast food chains. But here's the part that should genuinely concern you. Health officials say that source only explains part of this outbreak. There are still 5 separate, unexplained clusters of cases the FDA hasn't identified a cause for yet. So today we're breaking down exactly how big this outbreak has gotten, how a parasite most people have never heard of somehow ended up sickening tens of thousands of Americans this summer, why it's proven so difficult to trace back to its source, and exactly what you need to know to protect yourself and your family while this investigation continues. Before we get into it, hit that like button, subscribe to the channel, and tap that bell icon so you get notified as this outbreak develops. Because with cases still climbing and multiple sources still unidentified, this story is very much not over. Drop a comment right now. If you've dealt with a foodborne illness like this before, or if you've been affected by this specific outbreak, tell me what that experience was actually like. This is exactly the kind of illness people don't talk about enough, given how genuinely miserable it is. And I want to hear the real version, not just the case numbers. Now let's get into exactly how big this has gotten. Let's start with where the numbers actually stand right now, because the scale of this outbreak has genuinely surprised the public health officials tracking it. As of the Centers for Disease Control and Prevention's most recent national update, 10,468 laboratory-confirmed cases of cyclosporiasis have been reported across the United States since May 1st, with an additional 12,255 probable cases currently under investigation, bringing the combined total to more than 22,000 people. Cases have now been reported in 47 separate states, meaning this outbreak has genuinely reached nearly every corner of the country, rather than remaining confined to a single region. 517 people have required hospitalization as a direct result of their infection. And, most significantly, 2 deaths have now been confirmed, both in Michigan, both in individuals who officials specifically noted had significant underlying health conditions that may have been impacted by the combination of cyclosporiasis and the severe dehydration it can cause. Michigan itself has been hit harder than any other state, with more than 11,000 reported cases, close to half of the entire national total concentrated in a single state. To understand just how far outside the normal range this outbreak actually sits, it helps to look directly at what a typical cyclosporiasis season in the United States looks like. According to the CDC's own surveillance data, the agency had received reports of just 249 cases nationally by this same point last year, covering the identical May 1st through midsummer window. This year's total of over 22,000 confirmed and probable cases represents an outbreak running dramatically beyond anything approaching a typical season, and CDC surveillance notes specifically flagged this discrepancy as significant enough to warrant publishing weekly rather than the agency's more typical periodic surveillance updates. Throughout 2026, specifically because of how far case counts have diverged from historical norms. On a broader historical scale, cyclosporiasis cases in the United States typically don't surpass roughly 4,000 in an entire calendar year, meaning this summer's outbreak has already produced more than 5 times the number of cases the country would normally see across all 12 months combined, and it happened within a span of roughly 3 months. The outbreak's expansion has been happening in real time, even as this video comes together. Missouri's Department of Health and Senior Services reported 1,095 cases as of this past Sunday, nearly double what the state had reported just the week before, a genuinely alarming rate of week-over-week growth for a single state alone. And just this week, 6 additional states, Arkansas, Iowa, Nebraska, New Hampshire, and North Carolina, along with a renewed surge in Missouri specifically, were newly linked to the largest identified cluster within this broader outbreak, joining Illinois, Indiana, Kansas, Kentucky, Michigan, Ohio, Oklahoma, Pennsylvania, and West Virginia, which had already been connected to that same specific source. Now let's talk about that source, because it represents genuine, hard-won progress in an investigation that health officials have otherwise described as extremely difficult to untangle. The largest single identified cluster within this year's broader outbreak, now spanning at least 15 states across the Midwest and beyond, has been traced specifically to shredded iceberg lettuce supplied by Taylor Farms and sourced from central Mexico. That lettuce was served at Taco Bell locations, and on July 17th, Taylor Farms issued a formal recall covering the implicated iceberg lettuce, a recall that included both products sold directly at retail stores and lettuce distributed to restaurants and other food service customers. Taco Bell has since removed all of the implicated lettuce from its supply chain entirely. That's genuinely significant progress, tracing a specific outbreak cluster all the way back to a specific supplier and a specific growing region is exactly the kind of detailed epidemiological work that allows health officials to actually remove a contaminated product from circulation, rather than simply watching case counts climb without any actionable next step. But here's the detail that should temper any sense that this outbreak is close to being fully explained or contained. The FDA is currently investigating 6 separate cyclosporiasis outbreaks under its foodborne illness tracking system, and the Taylor Farms lettuce cluster, as large and significant as it genuinely is, represents only one of those 6. For the remaining 5 identified clusters, the FDA has not yet specified either their geographic distribution or any possible food source responsible for them. Public health experts interviewed about this outbreak have been direct in acknowledging that there are almost certainly multiple distinct sources contributing to this summer's overall case count, not a single unifying cause, and that officials expect cases could continue climbing through the end of August, as those additional, still unidentified sources remain under active investigation. To understand why tracing a Cyclospora outbreak back to its source is genuinely so much more difficult than tracking down a typical bacterial foodborne illness like Salmonella or E. coli, it's worth walking through exactly what this parasite is and how it actually behaves, because several of its specific biological quirks combine to make this exact kind of investigation unusually challenging. Cyclospora cayetanensis is a microscopic, single-celled parasite, and critically, humans are its only known host, meaning unlike many foodborne pathogens that can also live in animals, contaminated water sources, or soil independent of human activity, every single case of cyclosporiasis ultimately traces back to contact with human feces somewhere along the chain of contamination. The parasite spreads through what's called the fecal-oral route, meaning someone becomes infected by consuming food or water that has, at some point, come into contact with feces containing the parasite, typically through contaminated irrigation water used on a farm, or through poor hygiene practices somewhere along the food handling and harvesting process. Here's the first genuinely unusual detail that makes this parasite so difficult to control through standard food safety measures. Cyclospora is not spread directly from person to person, even in situations where you'd normally expect that kind of transmission to be a serious concern. That's because after the parasite leaves an infected person's body, it needs to spend anywhere from 1 to 2 weeks maturing in the external environment before it actually becomes capable of infecting anyone else. This is genuinely different from how most foodborne bacteria and viruses behave, and it means an infected food handler with poor hygiene at the exact moment of preparing food generally isn't the direct source of contamination the way they might be with, say, norovirus. Instead, contamination typically traces back further up the supply chain to contaminated water used for irrigation or washing during the growing and harvesting process, weeks or months before that produce ever reaches a restaurant or grocery store shelf. The second detail that makes this outbreak so stubbornly difficult to control is arguably even more consequential, and it's specifically flagged by the FDA in its own official guidance on this parasite. Cyclospora is genuinely resistant to chlorine and other standard antimicrobial chemical treatments that food producers routinely rely on to kill or remove other pathogens from fresh produce. That means the kind of chlorinated wash water commonly used in commercial produce processing, which is highly effective against many bacteria, essentially does nothing to eliminate Cyclospora specifically. Even at the consumer level, health officials are explicit that simply rinsing or washing produce at home, while still a genuinely good general food safety habit worth continuing, is unlikely to completely remove Cyclospora once it's present, because the parasite's outer shell is specifically built to resist exactly this kind of chemical and physical removal. The only measure health officials describe as reliably effective against Cyclospora is heat. Thoroughly cooking produce is capable of killing the parasite, which is precisely why virtually every past cyclosporiasis outbreak in the United States has been linked specifically to produce that's commonly eaten raw, rather than produce that typically gets cooked before consumption. The third factor complicating this specific investigation comes down to the symptoms themselves, and specifically their timing. Symptoms of cyclosporiasis typically don't begin until roughly 1 week after someone actually consumes the contaminated food, though that incubation period can range anywhere from as little as 2 days to as long as 2 full weeks. Think about what that timing actually means for anyone trying to trace their own illness back to a specific meal. A full week, or in some cases 2 weeks, is more than enough time for most people to have completely forgotten the specific salads, restaurants, or grocery store produce they consumed on any particular day, making the kind of detailed dietary recall interviews that public health investigators rely on to identify a common source dramatically less reliable than they'd be for an illness with a shorter, more immediate incubation window. It's worth understanding exactly what this illness actually does to the people who contract it, because the nickname explosive diarrhea, while genuinely accurate, undersells just how debilitating and prolonged this specific infection can become. The hallmark symptom is watery, frequently explosive diarrhea, often occurring multiple times throughout the day, and this specific symptom pattern tends to stand out from many other gastrointestinal illnesses because Cyclospora infections are notably not typically associated with significant vomiting or high fever, the way many other foodborne infections are, meaning people affected can sometimes mistake their symptoms for a less serious, more routine stomach bug initially. Beyond the diarrhea itself, common symptoms include cramping, significant bloating, loss of appetite, unintentional weight loss, a slight fever, nausea, and profound fatigue. Perhaps the single most distinctive and most frustrating feature of this specific illness is its tendency to relapse, meaning symptoms can genuinely seem to improve for a period, sometimes even for several days, only to return again in another wave, occasionally cycling through multiple rounds of improvement and relapse before finally fully resolving. Left completely untreated, the illness can persist anywhere from a few days to a full month or longer, and for people with weakened immune systems specifically, both the duration and the severity of complications can become considerably more serious, which is exactly why the 2 deaths reported in Michigan both specifically involved individuals with significant pre-existing underlying health conditions layered on top of the infection itself. Diagnosing this parasite reliably is its own genuine challenge, adding yet another layer to why this outbreak has proven so difficult to fully map and contain. A healthcare provider diagnoses cyclosporiasis by testing stool samples, but because the parasite can be genuinely difficult for standard laboratory tests to reliably detect, patients frequently need to submit multiple stool samples collected on different days before a lab can definitively confirm the parasite's presence. Compounding that difficulty, clinicians generally need to specifically request cyclospora testing when they suspect it, rather than the parasite automatically showing up on a more generic, routine stool culture panel, meaning cases can genuinely go undiagnosed or get initially misattributed to a more common, easier-to-detect cause, unless a treating physician is specifically thinking about cyclospora as a possibility. The CDC itself has been direct in acknowledging that because cyclosporiasis is commonly underdiagnosed and underreported for exactly these reasons, the true number of illnesses connected to this outbreak is almost certainly considerably higher than even the already substantial 22,000 confirmed and probable cases currently on the books. The genuinely encouraging news buried within all of this concerning data is that cyclosporiasis, once properly diagnosed, is straightforwardly treatable. Healthcare providers treat the infection with a 10-day course of the oral antibiotic trimethoprim sulfamethoxazole, commonly sold under brand names including Bactrim, Septra, and Cotrim. People with genuinely healthy immune systems will often eventually recover, even entirely without any treatment at all. Though as covered already, that unassisted recovery process can drag on for weeks and involves that characteristic relapsing pattern that makes the untreated experience considerably more miserable and prolonged than it needs to be. For anyone who is immunocompromised, specifically, seeking medical care promptly is particularly important, since a longer, more carefully managed course of treatment is frequently necessary in those cases to fully clear the infection. It's worth putting this specific outbreak into the broader historical context of how cyclosporiasis has behaved in the United States over past years, because this parasite genuinely isn't new to American food safety officials. It's simply having a dramatically more active season than usual this particular summer. Past U.S. outbreaks have been linked to a genuinely wide range of fresh produce over the years, including raspberries, basil, cilantro, snow peas, mesclun and romaine lettuce, cabbage, parsley, broccoli, and sugar snap peas, a list that spans considerably more than just the iceberg lettuce currently driving this year's largest identified cluster. Cyclosporiasis season in the United States is generally considered to run from May 1st through August 31st each year, precisely lining up with the peak months for fresh produce consumption, and case counts have consistently trended higher during warmer months in past years as well, though never anywhere close to the scale this specific summer has produced. Looking back at earlier, smaller domestic outbreaks helps illustrate just how much larger this year's event genuinely is by comparison. A notable 2013 multi-state outbreak eventually grew to 373 reported cases across multiple states before investigators traced it back to imported produce. And even that event, notable enough at the time to warrant sustained public health attention, represents barely 1.5% of this year's already confirmed and probable case total. Given everything covered so far, here's the honest, complete picture of where this outbreak actually stands right now. This is a genuinely significant public health event. More than 22,000 confirmed and probable cases across 47 states, 517 hospitalizations, and 2 deaths, running at a scale that dramatically exceeds anything the country has experienced from this specific parasite in recent memory, driven by a combination of the parasite's unusual resistance to standard chemical disinfection, its unusually long incubation period that complicates outbreak investigation, and, quite possibly, several genuinely separate contamination sources operating simultaneously rather than a single unifying cause. Real, meaningful progress has been made in identifying and recalling one major source, the Taylor Farms iceberg lettuce, linked to at least 15 states and directly tied to Taco Bell's supply chain. But health officials themselves are explicit that this identified source doesn't fully explain the outbreak's overall scale, with 5 additional clusters still under active investigation and cases expected to continue climbing through the end of August as that investigation continues. So here's what's actually worth knowing and doing with all of this, practically, starting today. Wash your hands thoroughly with soap and water, both before and after handling or preparing any food, a basic habit that remains genuinely important even though, as covered, it won't fully protect you against contaminated produce on its own. Wash fresh fruits and vegetables well under running water before eating, cutting, or cooking them, and specifically cut away any bruised or visibly damaged areas before consuming produce, since damaged plant tissue can harbor higher concentrations of contamination. Refrigerate any cut, peeled, or cooked produce as soon as possible, rather than leaving it sitting at room temperature. Given everything covered about Cyclospora's genuine resistance to washing and chlorination specifically, seriously consider cooking produce when that's a realistic option for how you're planning to eat it, since heat remains the single most reliable method available for actually killing this particular parasite, a meaningfully more effective step than washing alone during a period of active, ongoing outbreak investigation like this one. Check current recall notices directly through the FDA's website before consuming iceberg lettuce. Specifically, given the confirmed connection to Taylor Farms products sourced from central Mexico, and if you've purchased or been served shredded iceberg lettuce recently from a restaurant or grocery store, particularly anywhere in the 15 states already connected to that specific cluster, Illinois, Indiana, Kansas, Kentucky, Michigan, Ohio, Oklahoma, Pennsylvania, West Virginia, Arkansas, Iowa, Missouri, Nebraska, New Hampshire, and North Carolina, pay particularly close attention to any gastrointestinal symptoms that develop over the following 1 to 2 weeks. If you do develop watery or explosive diarrhea lasting more than a few days, especially if it's accompanied by significant bloating, cramping, fatigue, or any of that characteristic relapsing pattern where symptoms improve and then return, contact your healthcare provider and specifically mention that you're concerned about Cyclospora given the ongoing national outbreak, since, as covered, clinicians generally need to specifically request this particular test rather than having it show up automatically on a routine stool panel. If you're immunocompromised or caring for someone who is, treat any prolonged, unexplained diarrhea during this specific outbreak window with real urgency, given both the parasite's documented ability to cause more severe, longer-lasting complications in immunocompromised individuals, and the sobering reality that both confirmed deaths in this outbreak so far involve people with significant underlying health conditions. Stay hydrated aggressively if you do become infected, since severe dehydration specifically compounding an existing health condition is exactly the mechanism health officials identified in explaining both of the deaths reported so far in Michigan. And don't hesitate to seek medical care if you're struggling to keep fluids down or notice signs of significant dehydration, including dizziness, a notable decrease in urination, or extreme fatigue beyond what you'd expect from the diarrhea alone. And more broadly, keep an eye on official CDC and FDA updates on this outbreak specifically over the coming weeks, given that officials themselves have said cases could continue climbing through the end of August, and that 5 separate clusters within this broader outbreak still don't have an identified source, meaning additional recalls covering other specific products remain a genuine possibility as this investigation continues. Stepping back from the day-to-day case counts, here's the piece of this story worth genuinely sitting with as this outbreak continues to unfold. What's happening across the United States right now isn't simply an unusually bad allergy or stomach bug season. It's a documented, historically unprecedented outbreak of a specific, genuinely difficult to control parasite, running at more than 5 times the scale of what an entire typical year would normally produce, compressed into just 3 months, and driven at least in significant part by exactly the kind of industrial-scale, cross-border, fresh produce supply chain that makes modern food genuinely difficult to fully trace back to its source once contamination does occur. The successful identification and recall of the Taylor Farms iceberg lettuce represents real progress and demonstrates the food safety investigation system working roughly as intended. But with 5 additional clusters still unexplained and cases still climbing, this outbreak story is genuinely still being written, and the practical food safety habits covered in this video, thorough washing, cutting away damaged produce, and specifically leaning on cooking rather than washing alone whenever that's a realistic option, remain your single best individual defense while that broader investigation continues. We'll keep tracking this outbreak closely as it develops. Any updates to the case counts and the list of affected states, whether the FDA is able to identify sources for any of the 5 still unexplained clusters, and any additional recalls that may follow as this investigation continues through the rest of August. Subscribe and hit that bell icon right now so you don't miss those updates. because with cases still actively climbing and the majority of this outbreak's sources still unidentified, this is very much an ongoing, developing story rather than one that's already been fully resolved. And drop that comment below if you haven't yet. Tell me whether this changes how you'll be handling fresh produce for the rest of this summer, or whether you've already been personally affected by this specific outbreak. See you in the next one.